And hospitals aren't the only ones pleading with the community to take precautions and follow health district guidelines. Tonight, we hear from teachers, parents, and the school districts themselves, asking for everyone to do their part.
I feel like I was pretty careful when I caught COVID. I was having my students wipe their surfaces of their desks and their laptops off with disinfectant wipes.
Dawn Anderson says she did everything she could to prevent getting COVID-19, so she never suspected she could have it when she started to feel sick.
I had cold symptoms, but they always tell you to expect a fever, and I never had a fever, so I thought it was just a cold coming on, body aches.
Anderson says she tried to find a substitute to cover her ninth grade class at Madison Junior High, but she couldn't.
And this was all before I realized I was positive. Again, I didn't think I was symptomatic enough with the right symptoms,
but it turned out she was. Following the advice of her husband, who also happens to be a healthcare worker, insisted they both get tested.
I was positive and he was negative. Now, the only people I had been around for the previous 2 weeks was my students and my husband and my friend.
Dawn believes she must have gotten COVID from the school, saying that many of the students within her building don't always wear their mask. Even some of her colleagues didn't wear them when schools first reopened. It's a problem that the Madison School District says they're aware of, saying they're complying with Eastern Idaho Public Health District guidelines, but it's up to the individual to follow them. And in Bonneville County Joint School District 93, a similar story. A parent and staff member was notified that their child had been exposed to the virus.
I got a text first, and all the text said was in close contact with a staff member who has tested positive for COVID. Please check your email for more info.
That email went on to say that the staff member was actually an occupational therapist who was tested positive.
And I think that if the district can't protect their medical staff from getting COVID, what makes them think they can protect the children?
An issue that the district says they have been aware of, but are working to meet the community as a whole, trying to balance the need for education and the need for safety.
We said when we open up our school doors, we will have staff that get infected. We will have students that get infected. Are we ready to deal with the reality of that? Are we ready to deal with the consequences? And is that risk worth bringing our kids back to the schools?
And those are the concerns the districts are trying to address.
Well, I think the probably most important message I can share is that we're all in this together.
As a community, we need to come together to protect each other because we can't get the economy back on track and the schools up and running unless everybody's working toward that goal.
Just be vigilant. Just make sure you check for the symptoms, check their temperatures as often. Reiterate that they really need to wash their hands with hand sanitizer when they're not able to wash their hands.
And again, to everyone, the 3 W's: wash your hands, wear a mask, and watch your distance.